All right, before we begin, we wanted to let you know that we're broadcasting tonight's event live via our Facebook page and want to give a warm welcome to those of you joining us on Facebook. Thank you for being here this evening. A few housekeeping notes. We are recording this presentation and the PowerPoints will be shared with you after this presentation for those who have attended. After this presentation, there will be a survey for feedback on how we did and more information that you would like to know. It will automatically populate in your browser, so you don't have to do anything. And we ask that you complete that once you do leave this presentation. We encourage questions at any time. However, with case-specific questions and for the sake of privacy, please remember that this is a public forum and we are broadcasting live on the internet via Facebook. So all of this information will be there. So for the sake of privacy, please keep those questions to a minimum. And lastly, on an important note, even though our presenters tonight are professionals in their field, what we present should not be considered either legal or medical advice and should not replace a medical consultation of any kind. If you need either, please consult your medical professional or an attorney before making any important decisions tonight. Thank you so much for joining us tonight for tonight's special webinar, The Vaccine and COVID-19 in New York City Schools. With seemingly frequently shifting policies, mandates, and constant rumors and myths about COVID-19 and vaccines, we want to provide more clarity on both vaccine safety and efficacy, who is impacted and how, and understand the risk as well as protocols in place to protect our children, especially our most vulnerable students, the students with disabilities. We also want to dispel any myths or rumors or disinformation that might exist, and also answer any additional questions that you may have on these matters in a judgment-free and safe space. Our presenters tonight, Dr. Michelle Ramirez, a leading pediatric critical care specialist at NYU Langone, and Jose Rios Lua, director at the New York City Department of Education's Family Empowerment and Communications Office. They will provide critically clear guidance in helping you understand everything you need to know, including concerns around the new Omicron variant. Before I formally introduce our presenters, I also want to acknowledge our collaborators at Montefiore Albert Einstein College of Medicine, the New York Developmental Disabilities Planning Council, and our partners and collaborators at VaxFax DDNY, who all made this possible tonight. From VaxFax DDNY, allow me to introduce our colleagues and partners, Dr. Karen Bonnick and Joanne Siegel, the co-directors of the Rose F. Kennedy University Centers for Excellence in Developmental Disabilities, who would like to share more on the project.
Thank you. On behalf of VaxFax DDNY, we're really excited to have folks joining us. Just so you know a little bit about our project, VaxFax DDNY focuses on helping people with developmental disabilities and their families and agencies to make informed decisions about the COVID-19 vaccines. We are devoted to sharing updated and evidence-based information, such as you're going to hear tonight, across the 5 New York City boroughs, as well as New York State. We work with many community partners who help people who are speaking Bengali, Chinese, English, Korean, Spanish, as well as ASL to learn more about the COVID-19 vaccines. Just to let you know what we've been doing since February 2021, our team has held monthly meetings to brainstorm, including with local leaders such as J.C. Cortez and Paolo Jordan from Synergia. We've supported 11 vaccine education webinars in multiple languages. We have recorded 7 Why I Got Vaccinated videos that feature our very own self-advocates, as well as parents of individuals with DD in Spanish, Mandarin, and English. And we've also supported translations. We also share many of this information and more on our Twitter and Facebook channels. And with that, I want to thank you again for joining.
Thank you so much, Karen. Yes, and thank you for all of your support and that of your team, especially Rachel. Sad she couldn't join us tonight, but yes, thank you so much. So my name is J.C. Cortez, and I'm the Director of Training and Development here at Synergia's Metropolitan Parent Center. A few words on Synergia. Synergia is a multi-service agency located in Manhattan that has been supporting New Yorkers with disabilities and their families for more than 40 years. We offer a rich source of information and training tailored for parents, including parents whose primary language is not English or who they themselves have special training needs. We help them participate more effectively in their children's education and development, and we partner with professionals like we have tonight, as well as policymakers to improve outcomes for all children with disabilities. Synergia, which is Spanish for synergy, is one of New York City's three federally funded parent centers committed to serving people with disabilities and their families with an added focus on communities of color and the economically disadvantaged. Synergia creates innovative programs ranging from transitional housing for homeless families who have children with disabilities, an after-school program that we do in partnership with the Guggenheim Museum, as well as community residences for adults with developmental disabilities and parenting classes for adult parents with intellectual disabilities as well. Before we get to it, a bit of information of our guest presenters tonight. Dr. Ramirez is a pediatric intensivist at the Hassenfeld Children's Medical Hospital at New York University Langone Medical Center and Bellevue Hospital Center. Her clinical time is divided between the Pediatric Intensive Care Unit and the Congenital Cardiac Intensive Care Unit. Dr. Ramirez is a board member for the NYU Institutional Review Board and has been organizing and teaching the Pediatric Fundamental Critical Care Support course for the NYU Health System during the last 10 years as the course director. In addition, she currently sits as a board member for the Brooklyn Prospect Charter Schools. And after the devastation brought by Hurricane Maria in 2017, Dr. Ramirez became a founding member of the Puerto Rico Rise Up, a nonprofit organization created by female physicians with the goal of supporting underserved communities of her native Puerto Rico achieve greater physical and psychological well-being. She is also the current disaster relief director for this organization. Next, I'd like to introduce our esteemed colleague, Jose Rios Lua. Jose Rios Lua is the Director of Family Empowerment and Communications for the Division of Specialized Instruction and Student Support. Jose oversees all internal and external communication efforts related to special education, strategically coordinating across the division's different functions to manage communications to families, schools, and external stakeholders. One of the many hats that Jose wears is that of the host of the Beyond Access series. And this series shares information with families around special education topics and provides families the opportunity to learn directly from subject matter experts. Jose also serves on the planning committees for many of the Department of Education's inclusion initiatives, such as the Inclusive Education Student Summit, the Inclusion Expo, and the Disability Pride Visual Arts Contest. Thank you for being here, Dr. Ramirez and Jose. Welcome so much to Synergia. I'm so glad you could join us tonight. We have so many questions for you, so I'm going to just sit back and let us get to it so that you can present. For those of you joining us, after each presenter concludes their presentation, we will have a Q&A session. And if you're joining us via Facebook Live, if you have questions, please place them in the comments section where we'll be supervising those throughout the presentation. Dr. Ramirez?
Okay, thank you so much, JC. Thank you, Synergia, and Einstein. Can everybody see my screen?
Yes, just place it in.
I'm just gonna put it in slideshow, okay?
Perfect.
Okay. Now you can just see the slides, correct? All right, thank you so much. I'm really excited to be here and share with you a little bit of information about the COVID-19 vaccine and the current crisis that we are living in. I work as somebody who works in the ICU. I firsthand experienced the ravages of COVID-19. So, I understand the importance of getting this under control and trying to also move on with our lives. So what is the problem? Okay, so we know we have a global emergency. COVID-19 and its variants are a threat to public health. Currently, COVID-19 is one of the top 10 causes of deaths among children. And as of November 30th, 2021, 14.7% of children ages 5 to 11 and 61.1% of children ages 12 to 17 have received at least one dose of the COVID-19 vaccine. So we already have a nice group of children that have received this vaccine. So what tools do we have to fight the virus besides the vaccine? So obviously we have vaccination, which is free of charge, and it's available for children, currently for children 5 years of age and older, and for all adults. We need to be using face masks in enclosed spaces and in open spaces when distancing is not possible. We need to be able to get routine testing. We have to be doing strict hand washing. And if you feel unwell or you think you're ill, you should stay home. So let's talk a little bit about the rates of COVID infection, because I think this is important to get a little bit of perspective, because you might have heard, well, children aren't really getting affected. And I think that although it is true that children get less severe disease than adults, it is not true that they're not getting affected. So if we look at this chart, in the 0 to 4 age group, 2.6% of that age group is getting infected, which comes out to about 1 million cases. In the 5 to 11-year-old group, that's 5.8%, which is 2.3, a little bit over 2.3 million cases. In the 12 to 15 age group, it's 4.4%. So that's 1.7 million that have been infected with COVID-19. 16 to 17 is up to 2.7, which is another million. And then if you start going into the young adult of 18 to 29, that makes up 21.5%, which is about 8 million, a little bit over 8 million people infected with COVID. If you look at the total cohort of patients that are considered pediatric, which is usually from birth to 18 years of age, you have about 22%, a little bit over 22% of total cases of COVID under 18 years of age or in the pediatric group, which is really not insignificant. So how does it present? How different is COVID in children versus adults? Because we know that they're manifesting differently, and we know that they're not getting as significantly ill. So in terms of infectivity, at some point in the pandemic, you may have heard, well, children can infect you or children aren't as infectious. So we know that this is not true. The viral levels that children have are equal to the ones in adults. So they are equally infective. And a little bit recently, researchers from the University of Washington found that, when you look at children, they do have fewer symptoms than the adults. So when you compare them, 62% of children had symptoms versus 95% of adults had symptoms. And if you look a little bit further in terms of like what types of symptoms they had and how many symptoms they had, so the children with symptoms tended to have 1.6 on average as compared to 4.5 among adults, and what types of symptoms they had. So the children tended to have more runny or stuffy noses, along with a little bit of fever, headache, and cough, while adults more frequently reported headache, cough, and that feeling of being tired. And then you also may have heard about the multi-system inflammatory syndrome in children. There are two different entities. One is in children and one is in adults. So the child one is much more common than the adult one. It is a serious condition. It's associated with, can affect many parts of the body. It's associated with inflammation. It could affect the heart, the lungs, the kidneys, the brain, skin, eyes, or the gastrointestinal organs. So bowel, liver, and all those. So even if they don't have a lot of symptoms when they get acutely infected with COVID, they can still have this 10 to 14 days after being infected. And the worst part is that sometimes you don't even know they were infected. And the only way in the beginning when we were finding out what this syndrome was because we started doing antibodies, and we saw that at some point they had been infected. But as you can see, 40% of them won't have any symptoms. So then that can just make it harder for us to know if they had it and if they're at risk for having the MIS-C. And what about long COVID? So everybody has been talking about long COVID, and we don't really have a lot of information in terms of pediatrics, but more recently in the last few months, the American Academy of Pediatrics started reporting that children and adolescents are experiencing symptoms similar to what the adults have been describing as long COVID, which includes chest pain, cough. They can have difficulty breathing when they're exercising. They can have changes in smell or taste. although this is more common in the older pediatric age group, among other symptoms. And children and teens have also been reporting that feeling of tiredness, that brain fog, that they kind of like can't remember things very well. There's been an increased incidence of anxiety as well in those patients. There's joint pain, they have headache, they compare of sore throat. So they have like all these other symptoms that vary in intensity and duration, but can last for months, as we know that we have seen from the adult patients. And lastly, we have, everybody's been talking about the Omicron variant. So what do we know about this variant? So this is relatively recent. I mean, it's been maybe a few weeks now. It was first identified in South Africa. It is the newest variant, the variant that we have identified. What they have noted in South Africa is that they saw that there was an increased rate of hospitalizations when this started flaring. Now, they also noted that the group that was getting hospitalized more frequently was those families that the parents and the child were completely unvaccinated. The good news that we are, just from the last week, that we are getting from some initial data is that even though the Omicron variant seems to be much more infectious than any of the other variants we have known, including the Delta variant, its impact seems to be not as severe, meaning that it may not lead to as severe disease, which would be good news for us moving forward. So this is kind of like where we're at. We have new variants developing, we have MISC, we have long COVID, we have all those things that we know coronavirus infection can cause. So what do we have? We have the vaccines. And let's talk a little bit about the vaccines and what they are. So we have different technologies for the vaccines that we use. And I'm only going to talk about the top two because the other two are not available in the United States. So what we have right now is the mRNA vaccine. And this is the vaccine that has been developed by the Pfizer company and the Moderna company. And we also have viral vector vaccines, which is the Johnson & Johnson. I'm going to be concentrating more on the Pfizer vaccine because that is the one that is specific to our pediatric population, the 5 to 11-year-old, which was just approved or authorized. And, you know, as we go into the question and answer section, we can also talk a little bit about the other ones, but for the sake of time, I will concentrate on that. So the viral vector vaccines, how those vaccines work, basically they take a virus like the common cold virus, which is relatively harmless to most people, and they manipulate it so that it's weaker, and then they put a little piece of the COVID-19 information, genetic code, so that you know, when it's injected into your body, the body will recognize it as being a part of COVID-19, so that when you are infected or if you are exposed to COVID-19, your antibodies can quickly neutralize the virus. The RNA vaccine or the mRNA vaccine is completely man-made. It's synthetic. It doesn't have any live virus particles or any live virus carrier as the viral vector vaccine has. And it's basically giving a set of instructions to our cells to make a little part of the COVID-19 virus. And we'll talk a little bit more about that in a second. So if you look up here, this is what the picture of what the virus looks like. And you have this outside area, which is a crown, which is where the name comes from. For those of you who speak Spanish, corona, crown. So that's where the coronavirus name comes from. And these are little spike proteins. These little things right here are called spike proteins. And that is what the RNA vaccine tells our cells to make, okay? So it tells our cells to make that little spike protein so that our antibodies will learn and recognize the COVID-19 virus so that when we are exposed, it can be quickly neutralized. So let's talk a second about the Pfizer vaccine. So this is in Spanish, so I will quickly translate this and how they come. So the Pfizer vaccine, this is the adult dosing because it's a little bit different for pediatric, but it's 6 doses per unit. The dose is 0.3 ml. So this will be for our patients that are 12 and up. The thing about the Pfizer vaccine is that it has to be kept ultra cold climate because this mRNA vaccine, the mRNA fragments are very fragile. So that's why they have to be conserved in such a cold environment, which makes it a little difficult to be able to give everywhere because not everybody has a refrigerator capable of reaching those temperatures. The current age where that we are administering it is 5 years and up, and it consists of 2 doses separated by 21 days. The Mrna vaccine, which is authorized for or approved now for 18 years and up, has 10 doses per unit. It's 0.5 mLs. And that one you still have to keep in a cold refrigerator, but a little bit less than the -70. It can be kept at -20. You can give it to 18 years of age and older, and it's separated to 2 doses by 28 days. So there's a lot of questions about what is in the vaccine. And like we mentioned, it has that little piece of mRNA, the messenger RNA. And we have to protect that mRNA because, like we said, it's very fragile. So what we do is we put it in a little bubble of what we call lipids, which is basically fat. And we put it in this little fat bubble so that it can stay protected there. And you can see that when you look at the list of ingredients for the Pfizer vaccine, these are the listing that we have here specifically for the Pfizer vaccine. Those first ingredients that sound really weird are basically just fat and some cholesterol. Then we have some salts, and you can see the listing of the salts that the vaccine contains. And this is basically to help balance the acidity of the body because, as we said, the mRNA is very fragile. So if the pH, the acidity is not perfect, it can make the mRNA useless. So you need it to last long enough so that your body, it can give the instructions to your cells and your body can mount the response that it needs. And then it also has sugar, and this is going to help basically maintain the shape of the molecules when we have it in the very low temperatures. So that's it. These are the ingredients that the vaccine contains. So a lot of people have been concerned about the vaccine and have been asking since we started giving these vaccines back in 2020, are they safe? Because a lot of people, this is the first time that we have had a vaccine of this particular technology out for mass vaccination. So the Pfizer vaccine is currently authorized for use in children 5 to 15 years of age under the emergency use authorization. It is FDA approved for children over 16, and the Moderna is approved for 18 years of age and older. The mRNA technology is different from the technology of vaccines that we know from the past, but we know that it still generates a very good immune response against the virus. And even though this is the first time that this vaccine has been used to be given out in a mass vaccination fashion, this technology, so the mRNA technology, has been studied for the last 20 years in a whole host of different capacities, looking at it for treatments for different infections, even looking at it treatments for autoimmune diseases. So we do have a lot of experience studying this particular technology, or scientists have a lot of experience studying this particular technology. It's not that COVID infection came and they created this vaccine. They already had all the basic pieces of this, and they just needed to do some minor adjustments to it. As we mentioned, it doesn't contain any viral particles. It doesn't contain any live virus. It's just a little set of instructions. to tell your cells to make that little spike protein that is in the crown of the virus. And then it teaches our cells to make the spike protein, and our antibodies can recognize it. So there's been a whole lot of misinformation around the vaccine, and it's unfortunate because it has really hindered the public health efforts to try to get this under control. So I'm gonna just address some of these that I hear most commonly or that people ask me. If there's anything else specific, we can always talk about it in the question and answer section. So what things will the vaccine not do? The vaccine will protect you against COVID-19, will protect you against hospitalization, it will protect you against death, but it will not change your DNA, it will not change your genetic code. The DNA of our cells is inside the cell, and it's inside this other little section of the cell called the nucleus. The vaccine does not penetrate the nucleus. So if you're not inside the nucleus, you cannot alter DNA. The vaccine will not affect fertility. However, COVID-19 infection has been shown to decrease sperm count in males, so it actually can decrease fertility in males. And we are not even sure what COVID-19 infection will do to female fertility. That remains to be seen. It will not affect the brain. There was a time when everybody was thinking that the vaccines had microchips. There are no microchips in the vaccine. There is no evil plot from anybody to try to take anybody's liberties here. This is basically a public health effort to try to save lives. And the other interesting thing is that there was a lot of concern that the vaccine would stay with you forever, and how long do I have to wait to see those effects of the vaccines? So like we were mentioning, the mRNA, like the little piece of mRNA is extremely fragile. So once it is injected, it needs to give those instructions really quickly, because in a couple of days, it will be completely degraded by our body. So there will be nothing left. Historically, when we look at all vaccines throughout time, we haven't seen any reported side effects after more than 2 months of having a vaccine administered. And now we have, so basically the first vaccine trials started in the summer of 2020. So now we have over a year and a half of people that have been receiving the vaccine. So we have a lot of months of data. And we know that the side effects that we have seen from the vaccine have been seen between 6 and 8 weeks. After that, we haven't seen any other side effects. So we know that this is safe, and that if we're going to see side effects, we're going to see them soon after receiving the vaccine. So let's talk about our kids. So what about the vaccine trials in children? So we did a lot of exploration in terms of just like we did for the adult trials, in terms of making sure that this was safe for our kids. So right now, over 5 million children under 12 years of age have been vaccinated against COVID-19. And if you look at the 12 to 17 age group, over 11 million children 12 to 17 have received the vaccine. So that's a whole lot. They did the same phases that they did for the adult studies. There's usually 3 different phases that we do before the preclinical phase. So the clinical phase has 3 different phases. And they did exactly those as they would have in any other study. In the first phase, they chose the dose, and they realized that to minimize side effects, and because children are smaller than adults, it would be safer to give a smaller dose. So they first studied 3 different doses and realized that giving the lowest dose, which is 10 micrograms, was safe and effective. And this is a third of the dose of the adults. They gave that to 48 participants, and that's how they figured that out. Then they went to the next phases, which are the second and third phase. Now they gave a larger group of children. So they gave 1,500 children the vaccine and followed them for 2 to 3 months. They saw similar side effects to what they saw with the adults. Pain at the injection site, which usually happens with any vaccine. The kids were feeling a little bit tired. They could have a headache, some chills, muscle aches, and joint pain. The local reactions were less common than for the 16 to 25-year-olds. So for the younger kids, they saw a little bit of less side effects with that. And if they were getting side effects, usually they were seeing them in the first 12 hours. and they lasted no more than a few days. And in terms of how good it was, so they saw over 90% efficacy against COVID-19. So all good things. So what about heart inflammation? So there is this condition called myocarditis, which is an inflammation of the heart. And this has been seen with the vaccine. It is one of the potential vaccine side effects. But I think it's important to talk about the numbers, because your chances, or anybody's chances, of getting that heart inflammation, of getting myocarditis, if you get infected with COVID-19, is way, way higher than any chance of getting the heart inflammation with the vaccine. And the other thing is that the severity of it is much, much milder if it is related to the vaccine versus if you get it from the COVID-19 infection. So how many patients have had COVID-19, or what's the proportion that we were seeing that have had these myocarditis? So 1 of 45 patients that had COVID-19 had some degree of heart inflammation. So that would make it about 2.2%. And so far, out of the 5 million children, 5 to 11 years old, who have been vaccinated, we haven't had a single case reported of myocarditis. If we go to the older age group, so if we go to the 12 to 15-year-old age group who have been vaccinated, in terms of girls, we have 30 cases per a million. And in terms of boys, we have 200 cases per million, which is 0.0063%. And the highest incidence, we know that young males have the highest incidence of this side effect from the vaccine. So males 16 to 29 years old. So that's 10 from 100,000, which is 0.011. So if you compare the highest risk group, which is that 16 to 29-year-old male group, and compare it to the risk of myocarditis, you're comparing a 0.011% risk with a 2.2% risk. And just, this is a condition that happens, like the yearly incidence of myocarditis of for any reason in the United States is 1 to 20 in 100,000. So that's about 0.02%. So the vaccine-related, incidence is even lower than the yearly incidence that we have. All this to say is that it's really, really low. It's very mild. I haven't seen a single patient that has had severe COVID-19 vaccine myocarditis in my unit. I have seen very sick people with myocarditis related to COVID-19 infection. And let's talk a little bit about boosters. So right now, people are wondering, will the kids be required to be boosted? And although it's early and we don't know, we'll have to see how things evolve. I would not be surprised if we end up needing to boost our children. Now, to be considered fully vaccinated, you have to have received 2 doses in the case of children of the Pfizer vaccine, and 2 weeks must have passed since the last dose. Now, you guys may have seen in the news that the FDA approved the booster vaccine now for down to the age of 16 to 17-year-olds. And, I think as more time passes, they will realize that the optimal dosing is probably not just 2 vaccines, but probably 3 vaccines. And that might be, it's not, they call it a booster, but it's almost, I feel like, a little bit of a misnomer, because it should be a series and it should be like the 3rd vaccine of the series. And I think we should start thinking about it in that way, just like we have a lot of vaccines in childhood that we receive 3 to 4 doses across childhood. And sometimes we ask, well, I can still get a breakthrough infection if I'm vaccinated. So I think it's important to talk about perspective in that, because yes, you can still get infected, absolutely. Even if you're vaccinated, your chances of getting infected are going to be lower than if you weren't vaccinated, but you could still get an infection. But your chances of dying and being hospitalized from COVID-19 are significantly reduced if you are vaccinated. And I think this is a really nice, image, because it shows you the comparison of the number of people hospitalized, the number of patients in the ICU, and the number of patients on the ventilator. So the blue are the people who are fully vaccinated, and the black are the people who are unvaccinated. So out of that first group that was hospitalized, 274 patients were hospitalized. And out of those, only 26 of those that were hospitalized were the fully vaccinated, okay? So everybody else was unvaccinated. And then comes the more important question, how many ended up in the ICU? Because you know your severity of illness and your risk of dying are a lot higher when you start going into the ICU. So of that, 48 patients went in the ICU, and only one was fully vaccinated. The remaining 47 were unvaccinated. And how many ended up in a breathing machine and needed a breathing tube put in them to be able to prolong their life? So from all those patients that ended up in the ICU, 36 ended up on ventilators and one was fully vaccinated. So you're still really protecting yourself, even if you get an infection, if you're vaccinated. So what's the bottom line here? So if we vaccinate ourselves, if we vaccinate our families and our children, we're giving them the best level of protection we have against both this virus and, like we mentioned, hospitalization and death. We also protect our communities and our most vulnerable populations, which are the elderly, people with any sort of chronic health issue, people with weak immune systems, cancer patients, transplant patients. And we can also allow for a faster return to life as usual. We can minimize school closures from COVID-19 cases. We can allow our children to return to the classrooms with minimal interruptions. And if you guys have any more questions, I think it's really important where we get our information. So please, please, please always make sure that you go to reputable sources and sites. The CDC and the NIH are great. Obviously, please go to your health care providers to get information. If you are, you like more the social media aspect of things, there are good resources, but you have to be careful because there's a lot of misinformation out there. So you can look at Vaccinated, which is a great resource in Spanish, and it can give you trusted information directly from physicians. And if you want, there's also an English version. You can get it on Instagram, Twitter, and Facebook. They have accounts via This Is Our Shot, and they really have done a nice job of getting clearing misinformation and getting good information out there. And with that, I don't know if we want to do questions now or we want to leave them for the end, JC.
We do have some questions. So yes. So first off, how can parents of children under 5 mitigate risk, especially for children with sensory processing challenges who cannot wear masks or be vaccinated?
So I think for those particular age groups, you do your best, and you try to hopefully everybody in the house is vaccinated, so you try to do your part through that, and that way vaccinated and boosted, and you minimize your risk of infection in that way, avoiding any sick contacts of anybody in the family that may be isolating that person as much as possible, but always allowing for a main caretaker that the child trusts to be close by. You can try mask wearing as well for yourself. The child may not tolerate that. So, you do your best. Hand washing, all the basic things that we can do. In the end, you have to do your best because it's very challenging in those specific instances, especially if, there's not a separate caretaker that can basically isolate with the child and everybody's in the same house.
Yeah, no, that sounds very complicated and very challenging. We do have another question. It's in Spanish. I'll go ahead and translate it. Good evening. I would like to know if the doctors are recommending the vaccine to minors, the doctors, don't want to guarantee that it will not have secondary effects in the long term. Why is that?
Well, I'm not sure, any doctor is not going to be able to tell you there's not going to be any side effects, because there's like the immediate side effects that can happen. There are the risks if your patient ended up getting myocarditis, there's the risk of that. So nobody's going to feel comfortable telling you there's never going to be any side effects, because we know we don't live in a world of absolutes. So they're just being honest with you and not giving you false expectations. Now, the chances of getting any long-term side effect after 2 months of receiving the vaccine would be minimal to none, based on what we know from history, based on what we know since we've been using this vaccine for the last year and a half. There hasn't been anything reported past that window. So I would not expect that there would be any long-term side effects from that.
Thank you. And then what is the percentage of risk in developing Guillain-Barré syndrome as a secondary effect from the COVID vaccine? Do you know?
So that hasn't been that often reported with the mRNA vaccines. It's been more with the Johnson & Johnson vaccine. And so far with the kids, we haven't really seen cases reported on that. So, you can get Guillain-Barré from any virus. You can get Guillain-Barré from the flu shot. So there is definitely an increased incidence of Guillain-Barré for a multitude of reasons. And it looks like it was a little bit more associated with the viral vector vaccine, the one that has the little live virus, which makes sense because it's often, as a side effect from a viral infection.
Okay, all right. And then do you have any advice, thinking about meeting our families, especially the diversity that we have here in New York City and different cultures, especially where extended family has a greater impact in the decisions that are being made in our families, especially for our younger ones, the little ones. Do you have any advice for those parents that are trying to navigate all of this, the misinformation and then the cultural challenges? I've heard of cases where, parents have their parents back home in a foreign country, and their parents in the other country say, you don't need that, you shouldn't do that. Do you have any advice for those parents that find themselves in that particular situation?
I think all you can do is provide good, solid information and education, because I feel like a lot of people will hang on to sources of information that are really not reliable. And what I've done personally is I have family in Puerto Rico and I have family in Peru. My husband's family is Peruvian. And the amount of information that I get from Peru, from family members over there about information that is completely false is incredible. And I do something really simple. I look at the source of what they sent me. And if it is not a reputable medical source, which I have not found a single piece of information that they have sent me to be from a reputable source, it is often like either an anti-vaccine group or somebody who has another agenda, a political group, something else. Then I say, why are you reading this? Why are you believing this information that is not from scientists, that it doesn't come from physicians, that doesn't come from epidemiologists? The people that have studied this for years and are really there to help save you, because that's our only goal, right? We just want to save lives. We don't have any other motive. So I think if you educate and give them the information, show them that the sources that they're getting their information from may not be the best sources, and maybe replace that with a reputable source, little by little, you can start chipping away. It does not work immediately. This is like a long-term process. Like we've been doing vaccine talks for a year now, over a year, in different groups and different, capacities. And it gets better, but we still have a lot of work to do. So I wouldn't expect anything differently from our families.
Thank you. We do have another question. Are there any children with disabilities that maybe should not get the vaccine or seek further pediatric consultation because of a particular disability, medication, or allergy?
So obviously you should definitely talk about this with your own physician and, make sure that they know the patient's history the best. If there is a history of allergic reactions in the past, there are probably, you want to, no, probably not. Definitely you want to do it in a physician's office and you want them to be watched for 15 to 20 minutes after the vaccine. You want it to be in a place that could act if the patient started having an allergic reaction. So there should be medications available to deal with it because there is an increased risk of allergies if you've had, certain types of allergic reactions in the past. So that being said, that group has to be cautious. However, that is not a contraindication necessarily. It has to be discussed with your physician, and then you have to put the risk benefits. In terms of any drug interactions, there has been nothing up to date that we have seen. And the transplant population and the cancer population, the patients that are on chemotherapy that are extremely immune suppressed, have been receiving the vaccine without any effects. The only thing that we have seen is that their immune response may not be as good because their immune system is not that great. So they might need actually more doses of the vaccine to try to get them to a better level. And if that is the case of your family member, your child, you want to be always extra cautious with them, knowing that they may not have as good immunity as somebody else with a healthy immune system.
Thank you so much for that. I believe that concludes questions. Oh, I spoke too soon. If the children have a good immune system, what is the purpose of giving them the COVID vaccine if their proper organism can defend themselves?
So like we were talking about in the presentation, the risk of death from this is not zero. Even for children, it is significantly lower than for the adults, but it's not zero. So you're playing a little bit of Russian roulette, right? Because probably you'll be fine, but what if not? So that's one thing. The other thing is that even if their immune system works well with this, there's still the risk of multi-system inflammatory syndrome in children. So you can still get that, and that can cause a whole host of issues on inflammatory problems that will not be good for your child. And then thirdly, you have to deal with a long haul of COVID. And then if you get like a long COVID, you have to deal with all the brain fog, the anxiety, the joint issues, the headaches, the chronic pain things that we're seeing in patients that have long haul. So yes, maybe the immune system can fight it well, but are you really going to risk possibly death, very minimal risk, but possibly hospitalization, the risk of MISC, and the risk of long haul? I mean, you have to put that in perspective. But to me, for my child, the minute I was able to vaccinate her, she got her vaccine and she's fully immunized. So I would not recommend something that I wouldn't do for my own for other people.
I appreciate you saying that. And thank you so much, Dr. Ramirez. If there are any other questions for Dr. Ramirez, please feel free to submit them at any time. Now we're going to switch over to our colleague from the Department of Education, Jose Rios Lua. Jose, thank you so much for being here tonight. You already have a question waiting for you. Jose is with the Department of Education, and yes, he's going to let us know about everything that the DOE is doing in terms of keeping our children safe and how important this is to them as well every day. It's a struggle I can only imagine with the logistics of dealing with 1 million students. So thank you so much for making the time tonight, Jose. And please, I'll let you take the floor.
Thanks so much, JC. It's a pleasure being here with all of you. I'm not going to do a PowerPoint with you all because there's this thing that I like to do, and I think JC's seen me doing before. I like doing a DOE website walkthrough instead of a PowerPoint because there's a lot of information on the DOE's website. But I don't know if any of you have experienced in the past. It's sometimes a little tricky to navigate. It could be tricky to find information. So I would love to walk you all through where some of this information around health and safety lives on the DOE website, and then we'll walk through it because that has really all of the information that you would see in a PowerPoint around this topic. And so I'm gonna, technology willing, try and share my screen. And just see if I can get a thumbs up when you start seeing it. Perfect, great. All right. Okay, so this is the DOE website. One of the things, one of the things I like to start in every single walkthrough that I do of this DOE website is this section right here of the website, which is the powered by Google Translation. So what you do is when you click here, you have the options of so many different languages, more than just the 10 that the DOE translates everything into. And this automatically translates the entire website so that you can read it in whatever language you are more comfortable reading it into. Normally, I would only be talking about special education, and we'll talk about special education stuff in a moment. But I want to talk about health and safety first. And so when you get to the DOE website, when you scroll down a little bit, you'll see the section that's quick links, and you'll see that the first two things are COVID related. So there's a daily COVID map, daily COVID case map. We're going to go there in a moment. And then COVID information. So under COVID information, there's a series of pages, which is the health and safety in our schools, which is what we're going to walk through. Information around the COVID testing for students, the policy around testing for students, the map that we saw in the last page, and then a link to all of the school vaccine sites. We're going to walk through the health and safety in our schools page, because this page is where you're going to find information about the vaccine and any requirements around it for schools, the school visitor policy, the vaccine portal, health screenings, all of those things. And so when you walk through this page, the first thing you're met with is a 22-minute video with Senior Deputy Chancellor Marisol Rosales and Dr. Torian Easterling from the Department of Health talking together about the COVID vaccine for children 5 to 11 years old. And this is a great resource. If you haven't had a chance to take a look at it, I highly recommend it. And then we go straight into the Get Vaccinating section. And so what this is going to outline, one of the questions that JC has sent forward in anticipation, and I see that it's in here as well in the Q&A, is asking about vaccine mandates and what is it a mandate for kids to be vaccinated to attend school? The answer is no. There is no vaccine mandate currently for children to attend school. There is, however, a vaccine requirement for children who are playing particular high-risk sports. And so this section will outline all of those. So those high-risk PSAL sports or competitive after-school sports. And so it highlights them out as football, volleyball, basketball, wrestling, lacrosse, stunt, and rugby. Vaccines are also required for participants in bowling because while not high-risk sport, it takes place in a space that requires vaccination for children ages 5 and up. It also expands that COVID-19 vaccination requirements also applies to students participating in high-risk after-school extracurricular activities like chorus, musical theater, dance team, band, orchestra, with special concern for those playing woodwinds, marching band, cheerleading, step teams, flag teams. Students age 5 and up must be vaccinated in order to participate in these extracurricular activities. And so the deadline for students who have to take a first dose to participate in those activities was December 14th. And so this is it. When we're talking about requirements for vaccines from the DOE, it's just for these sports and these activities. There is no requirement to be vaccinated in order to attend school and get an education. One of the things that I hear questions about a lot is the visitor policy as well, because the DOE does have a policy in place that all visitors must show proof of at least 1 dose of COVID-19 vaccine to enter a DOE school building. And of course, visitors doesn't include our students. These are, parents, adults. It highlights the different acceptable proofs of vaccination that are available. And then there's information about the vaccine portal. We are encouraging families that if you vaccinate, your child is vaccinated, to upload that information to the portal, just so that we can have a record of it. There's information about privacy and security, and then of course technical support if you want to do it and you're having issues. As many of you know, there's a health screening that folks have to do to enter a building every morning. It's something that I have to do every day when I go to work. But it asks, and it's based off of simple questions about what you're doing. And then of course, here's our guidance on face coverings and PPE. You know, all students and staff must wear face covering during when riding on school buses and anywhere on school property, indoors and outdoors, regardless of vaccine status, unless they have a medical exemption. And so if a kid shows up and they don't have a mask, that's not a problem. Schools are ready to provide masks for them. There's also information about the physical distancing, social distancing, whatever you prefer to call it, in schools. And then of course the ventilation and cleaning. And then, as many of you know, our schools have served as COVID testing sites for randomized regular testing. So there's the outline information here, and this year, the thing to know about this is that this year, granting consent for COVID-19 testing is optional. Every school tests up to 10% of consented unvaccinated students. Student selection is a randomized process. Testing happens on a weekly basis. Pre-K and kindergarten students are excluded, and students with disabilities are welcome to be part of the randomized test pool as long as they are unvaccinated and have tested and testing consent on file. There's also information here about positive case closure and quarantine and how that's shifted. And then of course, I think the important thing is there's this concept of close contacts this year. And so the big question here is who will now be considered a close contact of a positive COVID case and therefore will need to quarantine. And so this is how the DOE and the Department of Health have partnered to define this the phrase of close contact. So any student within 3 feet of a student with COVID-19 in the classroom, regardless of wearing a face covering, any student who was within 6 feet of a student with COVID-19 when either student was unmasked, and any student or adult who was within 6 feet of an adult with COVID-19 for more than 10 minutes, regardless of wearing a face covering. Also, the question about how long close contacts have to quarantine. So fully vaccinated students identified as close contacts do not have to quarantine, provided they remain symptom-free. That's the key, symptom-free. So if there's a fever, if there's a cough, whatever it may be, then we have to quarantine. But if there's no symptoms, you don't have to quarantine if you're a close contact. And of course, we always, if you're a close contact, recommend getting tested 3 to 5 days after the exposure. Unvaccinated students, though, identified as close contacts must quarantine for 10 days. These, if students who are unvaccinated can test back into school, and there's a process outlined for that, and a proof of negative COVID test is required to come back and test out of those 10 days. There's also information, and I know many of you may have heard of this already. Medically necessary instruction is school for kids who can't attend school. So this is, every year there are some students with medical conditions that need to not go into a school building for medical reasons. And so we understand that there are some students who are at high risk who, because of COVID-19, have a higher risk. And so there's the Department of Health has outlined specific conditions that are particularly high risk. And for students, those students qualify for what's called medically necessary instruction, which would be which was formerly known as home instruction, or home and hospital instruction. There, for students who have these conditions outlined, there is a preliminary approval process while documents are being processed to get an official approval and into medically necessary instruction. So that is the page. This is where it lives. I'm going to drop the link directly into the chat, but I know that there's some folks who are watching who are not on the Zoom, so I'm going to navigate us to it one more time. So from the DOE website, COVID information, health and safety in our schools. I also want to talk about my world, which is special education. And, in walking aside from vaccines and testing for a second, talking about services for our students. One of the results of COVID-19 is this year we're offering special education recovery services. And if you haven't heard about special education recovery services, or this sounds like something new to you and your child has an IEP, highly recommend you take a look at what I'm about to share and reach out to your child's school to talk about, hey, what is the plan for my child's recovery services? So under learning, there's special education. There's this page called Family Resources. And in there, you're going to find the breakdown of special education recovery services. What is it? Who is eligible? What needs to be done? How services will be provided? That is all available on this page. And I can tell you really quickly that every child with an IEP is eligible for special education recovery services. And if you have any questions or concerns about special education recovery services, we've created a new email inbox that folks can write to, called SERS, which is Special Education Recovery Services, but the abbreviation is SERS, S-E-R-S, at schools.nyc.gov. I'm going to leave it there so we can get to questions because I see them piling up. So, JC.
Sure. So where do we begin? So how well prepared and trained are the nurses in the schools to administer the COVID vaccine, especially in schools with medically fragile kids? And how prepared are they to react under an emergency after applying the COVID vaccine to a child?
That's a great question. And so I, being someone who works in special education and not for the Office of School Health, I'm going to answer that the best way that I know how. And that is, to my knowledge, the DOE partners with the Department of Health to provide vaccinations and vaccine sites. The Department of Education itself, and by extension, I believe our school nurses aren't the ones who are providing the vaccinations for kids. So that's as far as I know. I could be wrong. I will double check that throughout while we answer other questions. But from what I understand, it's the partnership with the Department of Health who are providing, and so there have been conversations about how. Even before we started vaccinating, well, even before vaccinations were a thing, when we talked about last school year, the randomized COVID testing, there was a lot of conversations about how well trained are staff going to be with dealing with students with disabilities. And the biggest thing was like, we want to make sure that everyone is safe. And so we had a lot of conversations about, listen, these are some of the accommodations that students with disabilities might need. They might need someone who's familiar with them in the room. They might need to, a parent's family should be able to say, actually, we feel more comfortable if our pediatrician did the COVID test instead of someone in the school. A parent might need to be present. So that's why it would be important to do it with a pediatrician. So those flexibilities were talked about beforehand during the COVID testing days. And those things transitioned over as well to the conversations around vaccines. I think in general, there's the general underlying question of like, what should I prepare for if my child has sensory needs when getting vaccinated? And I've heard some like really amazing things from advocates in health spaces for thinking ahead of how that experience is going to happen. So depending on where you're planning on having your child vaccinated, if you might want to call ahead and ask for certain accommodations. I've heard some brilliant suggestions. Some of them are like Maybe instead of sitting for 15 minutes after the vaccine, you can have an accommodation to walk, because sitting for 15 minutes might be an issue. You can also ask if like your child is overstimulated by certain sensory issues, like ask if it's possible to have vaccinated in a quiet room, or have some, if audio is not the sensory issue, it's visual, if it could be behind a screen. It never hurts to ask these things, and really the reality is we want to do everything, and you all want to do everything to make sure that the experience is positive for your child. You don't know, we're not trying to create negative experiences for kids ever.
No, absolutely. And those are great suggestions. Thank you for that. So yes, so I believe you already answered this, but what happens if the DOE is mandating that all children be vaccinated? There is no mandate. As far as we know, there's no intention of having a mandate. However, we are changing administration, so I guess we'll just keep
Well,
our...
and the thing to say there is that, like, yes, we're changing administration, sure, and we don't know what school vaccine mandates will look like in the future, but the DOE would not be mandating a vaccine. So the New York State Department of Health, not the DOE, oversees vaccine requirements for schools, and we will follow their guidance. So at some point, if the New York State Department of Health decides to create a vaccine mandate for the state, then the DOE would have to comply with their guidance.
That's a great clarification. Thank you, Jose. Yes, also let me see, there's one in the chat. In recovery services, will children that are not vaccinated be able to participate?
Absolutely. Yeah, there's no, like we were saying, there's no requirement to be vaccinated to enter a school. So yes, absolutely. And those same, health and safety guidances that are being run during the school day are going to be run during special education recovery services. So folks will be masked, the distancing will be the same. We're not new to providing in-person services in the pandemic. I know many of you might already know this, but special education was really the first to provide in-person services to students during the pandemic. We started in the summer of 2020 by providing in-person related services, and we've learned a lot. We've fine-tuned a lot of things, and we know that there is a possibility, and we are able to provide these much necessary services to children in person when we're following the right health and safety protocols.
Thank you. And also, let's see. When are you going to allow teachers who did not get vaccinated return to school? They should be able to take a COVID test weekly and not be obligated to be vaccinated. My daughter lost a great teacher because of this.
So the thing here, I understand and I sympathize where folks are coming from on this, but the reality is, in schools, I want to say this as empathetically as possible, but not getting vaccinated is a personal choice that one should be able to make about their personal life. But when we're talking about schools, we're not talking about personal choices. We're talking about the choice, the health and safety of other people's children. And so it is important. It is the most important thing to make sure that schools are safe and welcoming for everyone's child, so that you all don't have to worry if your child is safe, because that is what we're talking about. We're talking about health and safety of other folks. And Dr. Ramirez could probably talk about this better than I could, about the public health component of this and the importance of it. But at this moment, and what we think is the foreseeable future, all staff working in a DOE building need to be vaccinated, whether they are a DOE employee or a CBO employee. All school-based staff were required to get their first shot by October 4th. And we really see that as being necessary to be able to continue to keep our schools open and be able to offer in-person education.
Jose, I'm just wondering, can you talk a little bit about what is the procedure when a child tests positive? Like, what happens in that situation? Because I know we have what is it called? Not the situation, is it the situation
the
room?
Situation room? Yeah, absolutely. Yeah, I'd love to talk about this, and I actually had to learn about this to come to the meeting, because I had an understanding of it and needed someone to no, this is the actual process. So so if a child tests positive for COVID-19, regardless of vaccine status, the child must quarantine for at least 10 days. The child needs to be fever-free for 24 hours without the use of medications, or overall symptoms need to be improving in order to return on day 10. So this point is important because it sounds a little different from what is considered a close contact. So if you test positive, period, end of story, vaccinated or unvaccinated, there's a 10-day quarantine. And then you can come back after your 24 hours without a fever or symptom-free. If you're a close contact, right, and you're vaccinated, you don't have to quarantine if you don't feel symptoms. If you're a close contact and you're unvaccinated, then you do have to quarantine for those 10 days and you can test back on day 5.
Okay.
If a child and I'm trying to read these notes here, but I just literally was going to read what I just said about close contacts with vaccinated and unvaccinated. But the one thing that's important to understand is with these guidances, because they're health and safety guidances, there's no difference in the quarantine guidance for students with disabilities. So if a student with a disability tests positive, they need to quarantine. If a student with disability is a close contact, if they're vaccinated, they don't, as long as they're symptom-free. If they are unvaccinated, then they do, and they can test back to come back in.
Okay. And in what situation is it that a school actually has to shut down? Do they close down the school, or is it just like they shut down the classroom? How does that work?
Yeah, so both, right? Both situations are possible. And so there are situations in which a classroom might shut down. There are situations where, well, first there's a situation where a classroom might not shut down if there's a positive case, as long as there were no close contacts. If folks feel there's the following situation is the classroom may shut down. And then of course if there's widespread, if the Department of Health and the DOE determine that it's widespread across the campus, there is the possibility that a school could shut down. And so the policy changed a little bit because early on, the policy was based on a specific number of cases and a specific percentage of cases. And so in the current policy, we know how important it is to keep schools and classrooms open for learning. And we've done everything we can to make sure that classrooms are equipped to be safe learning environments, including mandating that all staff are vaccinated, ensuring increased ventilation in schools and buildings and classrooms. And these measures will mean fewer disruptions to child education. So as of September, the DOE no longer automatically closes an entire classroom when there's a positive student case in the class. Students who are wearing face coverings and have maintained at least 3 feet of distance in the classroom from a student who tests positive will not be considered close contact. So that point of being a close contact is a distinction from the previous policy on school health and safety. So that's running. That is what is managing. So the school closure, class closure, those types of things. Schools will be closed only when it is determined by the Department of Health and the DOE that there is a widespread transmission in the school. So it's that situation room that you mentioned earlier, JC. That is a cross-agency collaboration, and it brings together folks, because the reality is the DOE, we're not doctors. We're an agency of teachers, and what we know is how to educate children and provide them a free and appropriate education. And the Department of Health, they are the doctors. They should be the ones. They're the ones who follow the science closely. They're the ones who should be able to make those calls of whether something is widespread, whether a class should be closed, whether there's enough positive cases to close the school. And then we're relying on that partnership.
Okay. Is there a place on the DOE website where, all these policies, they require certain shifts and changes as we learn more about this virus? Is there a place specifically on the DOE website where we can go for like the newest updates?
Yeah, absolutely. And that's, I'll drop the link in the chat, but that is the health and safety in our schools page that I shared and walked y'all through. That is updated regularly. And so that's going to have all of the resources around COVID health and safety.
Okay. And then There was a question here. And I'm not sure that the appropriate page answers this question. Maybe you can provide some more insight. For a child that is unable to wear a mask, is the remote option or the home instruction option automatically available to that student, or?
So two things, because I think this is, I've heard this being said, but there is currently no remote option for students who attend school. There is the medically necessary instruction. Not being able to wear a mask is not one of those things that automatically qualify you. What I will say is that we've worked with our paraprofessionals, with school staff, and really increased training to provide resources to help children build mask tolerance. And we've been doing that since the days of blended learning, right? Because when kids came back and we're only in for 2 days or what have you, we knew that there was going to be issues, especially with children with sensory issues and touch sensory issues. And so schools have been working with children to build that tolerance and take breaks when necessary and all of those things. There are resources in place to be able to support students who may need additional supports to tolerate masks.
Wow, okay, that's great. I didn't know that. Okay, let's see. Do we have any other questions? Yes. If my child returns from an international trip and has been vaccinated, even if their PCR is negative, what is the protocol for them to return to school? Do they have to stay in quarantine, or do they need to do another PCR in order to attend class? That's a great question, especially with the holidays coming up.
Yeah, it is a great question. But to my knowledge, there is no guidance about restriction. If you test negative, you test negative and you go to school. I don't think there's any guidance that I'm aware of that requires families to provide testing results after traveling. But that's a great question, because it is travel time, holiday time for a lot of folks. I know for my family, it's a time where we go to Mexico and we see family. So I can see how that's a concern. I highly encourage everyone, to get tested, and Dr. Ramirez could probably tell us a little bit more about what are the proper timelines after being in a high risk situation. But so I recently traveled and I was tested before returning into the country. I know that federally, like the guidance has changed. Like when I traveled, it was 3 days before you took a test, and now it's 24 hours before your flight. But when I came back, I took an additional test just to make sure, because I'm a crazy person, and all was good. It's important to know, but if that test when you come back is positive, it's important for you to let your school know, so that they can support you appropriately. But also, if your child did come back and engage with anyone, they can make sure to notify the right folks.
Dr. Ramirez, do you have any additional insight or guidance into what would be appropriate in terms of testing, especially with the holidays upon us and travel season, traveling to, a level 3, level 4, or whatever the CDC has assigned a certain country based on the infection rates? Do you think there's added incentive to do another test after the travel test that is required to travel 24 hours beforehand, before returning to school in those cases?
I think so. I think, you may have still just gotten exposed towards the end of your trip, and you wouldn't really develop symptoms until a few days after. So I think it's completely reasonable to, like, 3 to 5 days after you arrive, you get tested. And if you don't want to do like if you don't want to go to a place and do a PCR, if you can get like one of the at-home COVID tests, which are also very reliable, you can do that. But I think we should certainly be extra cautious. My hospital is requiring, 5 days after you arrive to get COVID tested if you do international travel. So, we're obviously working with patients and with vulnerable populations, so I think it makes sense. But I think it makes sense for everybody because you maybe don't have any symptoms of you, or you can be asymptomatic or you're pre-symptomatic, and you may actually be spreading the virus. So I think it's reasonable.
And a quick medical question, Dr. Ramirez. After a child, say now that the children between ages 5 and 11 are eligible to receive the vaccine, how soon does immunity really build up within them? Because I'm sure it's different in them as it is compared to us adults that had to have 2 shots. How quickly do they build immunity over time? For example, if a parent that is traveling internationally just got their child vaccinated, when does it become like less of a concern, I guess?
So really not until, even though children certainly have more robust immune systems than us, the requirement is still the same, that it's 2 vaccines that they need to receive. If you're 1 week post-vaccine, you're gonna have post this 2 shots, you're gonna have pretty good immunity. But you know, from the studies, we have seen that to get the best antibody response, it's 2 weeks post-vaccine. So that would be the ideal time. You know, you can always do things to mitigate, like we are actually traveling to see family in Peru because we haven't gone since 2019 to see them. So I can show you right now that I have next to me tests, and I have boxes of like all these tests that I have, and I have like 10 boxes that I'm taking because there are going to be like family events and we're doing them outside and we're trying to be like, you know, extra cautious, but still, before going anywhere, I'm going to get tested. After, you know, going places a couple of days after, I'm going to get tested. And I'm going to be super neurotic about this because I know that this is extremely contagious, that you may not show symptoms and that you may unwillingly be infecting somebody that maybe I would be fine, but that person maybe would not be fine. So I cannot personally have that burden and live with that. So yeah, so that's what we're doing in my family. And maybe that's a little bit of an overkill and not everybody has to do that. But obviously I have had my own experiences in this pandemic that have, you know, shaded me in one particular way.
I feel a lot less crazy now hearing a doctor say it, because I'm glad that like we're on the same page, Dr. Ramirez, because for me, it's not just the travel itself, right? The travel itself is risky, but even after your 24-hour COVID test to come back home and back, you're still going through a densely populated area and on an airplane, airports, getting back home, all those things. And so it's all about risk mitigation and all of and that peace of mind so that you keep yourself healthy. And I can't stress this enough. It's not just about keeping ourselves healthy, it's about keeping the people around us healthy as well.
100%. Yep. It's a community, right? Like, you know, a lot of us would be fine, but you know, I have patients that the granddaughter got COVID and the granddaughter was fine. The grandmother was not, and she spent 6 months in the ICU and almost died. And for that family, the burden of that is just, it's not worth it. Like really, and this was like early in the pandemic, like, you know, pre-vaccination and all those things. So they didn't even have those options. So now that we have like all these options and things we can do, I think we just really have to be hyper vigilant for our communities, not just for our own sakes.
And Dr. Ramirez, do you have any suggestions or tips for families that are traveling, since we're talking about traveling in holidays and colder times, right? Depending where we're going. Do you have any tips for family gatherings where people might be mixed, vaccinated and unvaccinated for their children? What can you tell parents for that?
Yeah. So you're not just talking about the children that are not vaccinated, you're talking about adults who refuse to vaccinate.
Correct.
That is something that, you know, every person has to do, you know, has to decide what, again, risk factors and risk mitigation and how much they're willing to do and how much they're willing to take on. In the physician community, I can tell you that family members that are unvaccinated are, for the most part, unless they're doing activities outside, not getting together for the holidays. So in our, you know, we're going to Peru, everybody that we're seeing is vaccinated. Mm-hmm. So there's not a single person who's unvaccinated. So I get it, because you still want to see your family and you want to do the holidays and you want to get everybody together. But honestly, at this point, there should not be a single person that doesn't want to get vaccinated. We have, over a year of data. We have all the information that we need. We know this is safe. We know this is effective. The physician community has done it, has gotten themselves first in line, because we were the first ones that could get it. I got it December of 20, my first one, January of 2021, I got my second one, and I just got boosted in November. So, we're doing it to ourselves. We're giving it to our children. We wouldn't do this if we didn't think it was safe. So at this point, it's almost like, it feels a little bit, I don't want to sound mean, but maybe I will come off as mean, but it feels a little bit selfish if you don't want to get vaccinated at this point. So I'm gonna be like, no holds barred, super honest, because it's not just about you, it's about our community and making sure that we can all together get through this. And if we can't get through this, more variants will keep coming, and we're gonna be like, this is getting old. We've been on this for a long time. We're all tired. People are tired of being home. People want to go back to their lives. I get it. We all want to do that. So we have to do that together, and we have to move together.
Thank you. Here's a question for both of you that we just received. My child has a diagnosis, and however, he bled with the COVID test they did to him at school. Is there another option that we can choose so that doesn't happen again?
They did the nasal swab.
It didn't indicate nasal, but I would assume yes. That is what they're doing in the schools, right? Right, Jose?
Yeah, I believe schools are doing the short swab. They're still doing short swabs, and so what I understand is that actually, yeah. So confirmation that it was a nasal swab, but what we've been told to tell folks on that front is the reason we chose to do the short nasal swabs was because there's much less of a risk of nosebleeds and it's a lot more comfortable and all those things. But I'm sure Dr. Ramirez can talk about the different types of tests that exist.
Yep. So there is a salivary test as well. That I am not sure how available it would be in the school system, or if that is even an option, to be honest with you. I agree that if you're doing a superficial swab, they should not be going so deep that you can cause bleeding. The deeper portion of the nose has a lot of veins and arteries, so if you do that very harshly, you can cause bleeding, but the outside does not. So if they do it really superficially, I would not anticipate that's a problem. But if you want to be extra, have an extra level of, care, you can look into those salivary tests.
All right, thank you. And here's a question, Jose, for you. For special needs children, it seems that the schools, such as District 75 schools, for mask wearing, especially for children with autism, it seems that they are more strict than school buses with the mandate, as this is special needs kids. Why is that? Sorry.
Yeah, no, listen. The mask policy is in the classroom is the mask policy on the school bus, right? And so if you're seeing or your child is telling you that there are kids on the bus who aren't wearing the mask, we want to know that. But I know that the resources have been released to even bus paraprofessionals and matrons for children who require those things to aid in prompting, right? So sometimes we do this as adults where we're wearing a mask and we pull it down to pull our nose out or whatever, or we forget, it slips, whatever. There's prompting to be like, oh, let's lift our mask and those types of things. Those resources are available as well. And yes, children should be wearing their masks in the school bus as well. So that is, it is equal.
Thank you. Will the kids need boosters every 6 months like the adults, Dr. Ramirez, or will everybody need the boosters every 6 months after the second dose?
So right now, the recommendation is that everybody get boosted. It is the way to like increase your antibodies to a level. We know that 6 months to 8 months after that second shot, our antibodies start going down. So we are not as well protected. And actually just today, Dr. Anthony Fauci from the CDC was saying, from the NIH was saying that, you know, with the Omicron variant, there is a great increase and a great boost in antibodies when we receive the third dose. So for now, that seems to be the case. Whether we're going to need to be getting more boosters, it is unclear at this time, because it might just be that we actually needed 3 doses instead of 2 of this vaccine, and maybe that'll be enough. Or it may be that immunity every year, so it'll be like another flu shot or something along those lines. So we'll have to see how this progresses. It's hard to know, you know, which way this will go, and also how the kids' immune systems, maybe their immunity will last longer than ours. As you know, children have a little bit of a more robust immune system, so we'll just have to see how it plays out. It's hard to predict which way it'll go. But for now, certainly if you can get your booster, get it, especially with the holidays and, you know, anybody who's here in the city, we actually have surges going on, the cases are going up. So just have every level of protection that you can.
And Jose, that brings me to a question when it comes to vaccinations. Is the Department of Education still providing vaccines in schools? I remember when they immediately became eligible, there was a citywide campaign, but it sounded like it was only for a limited time. Was that the case, or is it now like a mainstay?
So no, that is the case. It was for a limited time, and I'm trying to so like as soon as the vaccine was approved, we did partner and launch these sites, and so as soon as it was authorized for ages 5 through 11, the DOE provided 2 vaccine pop-ups clinics at every school, serving students ages 5 to 11. This enables students to receive vaccines at schools during the school day. There is I think all of the dates have passed, to be honest. I'm looking it up on the DOE website right now. And yeah, I think they just wrapped up this last week. But that is not to say that there may not be more coming, more opportunities. There absolutely could be more opportunities, and we've been pushing folks towards vaccinefinder.nyc.gov to help find a location close to them to get their child vaccinated. And again, if you're going to set up an appointment for your child to be vaccinated, I think it's worthwhile, especially if you have a child with a disability, to ask those questions when you're setting up the appointment of what your child is going to need to make this a positive experience.
Sure. And just, I know the answer because you and I have shared many spaces together talking about this, but just for those joining us here, the vaccine portal, that information is separate from the DOE information, if I'm correct, right? It's on a different database and everything entirely.
From what my understanding, it's a fully different system.
Mm-hmm. Yeah. There is a clarification on this question that was asked earlier about the schools mask wearing and buses. What was meant to be said was that schools are more flexible with mask wearing for kids on the spectrum, but the buses just seem to insist that masks are worn at all times. Okay, so maybe more of like an inconsistency in the enforcing mask wearing on buses.
Yeah, I'll definitely share this feedback with our colleagues in busing. But really, like the reality is that, you know, this isn't a student with like disability issue. It's just a children issue that, like, you know, children need some additional support with wearing masks and tolerating it. And it's interesting because that like buses are more strict about this. Or maybe it's not that they're more strict about it, but it's just that they, you know, schools are so used to working with children for long periods of time. You know, they're the whole day. So I'm definitely will share that feedback with our colleagues at busing.
All right, thank you so much. Well, seems like we're gonna be able to give some time back to everybody tonight. If you have any other questions, please ask them now as we wind down. But thank you so much to our presenters, Dr. Ramirez and Jose. Thank you so much for making the time and talking to us on such an important topic and giving us so much clarification. I did want to mention one thing that we haven't talked about before we go, and that's dispelling the public charge. I don't know how many of you, how you've heard about this, but I've heard of cases where there are many families, immigrant families or undocumented families who are not getting tested, who are not getting the vaccine out of fear of jeopardizing their immigration status. And I just want to make sure that everybody understands that those policies no longer exist. That was something in the Trump administration, and they have been since reversed or eliminated now that we are in the Biden administration. That is not the case. You do not have to have insurance. You do not have to have a social security number. And getting that is not going to jeopardize you in that sense at all. And I just want, have you guys heard anything different or anything that can help parents understand that better?
So I've definitely heard this concern, being, holding space with a lot of folks who are immigrants and coming from a family of immigrants. I've heard this concern in like folks who I'm related to. And I think one of the things in one of the spaces that I was in, someone said, it's particularly about testing. On vaccination, everything you said is ditto, but particularly on testing, I had someone in a space that shared, you can walk into any pharmacy and buy an at-home testing kit like the ones that Dr. Ramirez had showed you. So like there's ways to, if you are so uncomfortable, because I understand, coming from a family of immigrants, I get it, that there are moments that we're not ready to make a full step right off the bat. There are still things that you can do to protect yourself and those around you when it comes to testing, and like walking into a pharmacy and getting one of those $20 at-home testing kits was one of the things that was suggested in the space. While there are barriers to access and money and all those things, I thought it was an interesting way of posing that there is a way to create a comfortable space to be able to access testing.
Thank you, Jose. Dr. Ramirez, did you have any insight into that or any other additional comments that you'd like to add?
I mean, certainly, the at-home testing is an option. Those tests are on the expensive side. However, anybody that has any sort of medical insurance, whether it's government or, Medicare, Medicaid, whichever one, starting from January, those tests should be covered by the insurance. So if you have something or somebody who has that insurance, they can actually like get those tests for you and they will be covered by the insurance. So there's one idea. The vaccines, are free of charge, and anybody can get them, like you said. Like, it is untrue at this moment that your legal status in this country would impact that. And there are lots of government, tents out there for testing as well, that are also not going to care if you're here legally or illegally. A case in point, my mother-in-law was here visiting, and they didn't ask her for any passport for anything. She's not a citizen of this country, and she got tested because she needed to for her flight back home, and she didn't pay anything. So, it's covered by the government, which is not the same in many other countries. And they really, at this moment, won't care about your citizenship status.
And that is the single most important tool to make other people feel comfortable getting vaccinated, getting tested, is telling our stories and sharing our experiences with folks. So one of the things that I always say when working with folks who are undocumented is for folks who are documented to share their experiences, because when I got vaccinated, right, they asked me, to ask what borough I lived, and that's about as much documentation that I shared with them. And they didn't ask me about if I was a citizen, if they didn't ask me if I was here documented or undocumented. So I think sharing that experience with folks who are undocumented can do go a long way to make people feel at ease with those experiences.
Yeah,
I completely agree.
100%. And I
Well,
also know plenty of people that have come to this country, not US citizens, for the sole purpose of getting vaccinated. And they got their vaccine without any problem whatsoever. And then they went home. So, it's definitely like something that people can do and set their mind at ease, because a lot of other people have done it.
thank you. I see my colleague Joanne on the screen. Joanne, did you have
Yeah, I
some?
just want to make a couple of comments. Number one, I think too, on that note, New York City Health and Hospitals Corporation is doing a great job in terms of getting people vaccinated. And so you can go and call 311 and you can get the number. But if you have a computer, just go on New York City vaccine information. You can go to their hotline and get information. I put in the chat box the Rose Kennedy Center Children's Evaluation and Rehabilitation Center is having a children's vaccine session on this Friday from 7 in the morning to accommodate families that may want to get their children to school or before school rather. And I think it's going till about 3 o'clock in the afternoon, but you should just contact the contacts there, Andrea Descher at Einstein. I'm sorry, it's Einstein Med. Let me just change that. It's they changed their website. It's Einstein Med dot edu. Okay, Einstein Med dot edu. All right, and it's Andrea, ANDREA dot DEISHER at Einstein Med dot edu. Okay, and talk with her, and you need to get pre-registered. That's the only thing that, in other words, they want to make sure they have enough staff there to accommodate. But again, these are staff that are used to working with children that are special needs children, and there is supportive staff there working on this. And I think they're giving away teddy bears.
Oh, I want a teddy bear. Thank you so much, Joanne. All right. Well, thank you so much, everyone. We don't have any more questions, so let's go ahead and wrap up. Just want to say thank you again for those of you for making the time to present for us tonight. Thank you for everyone at home for joining us tonight. We hope that you're leaving with a better understanding on COVID and the vaccine in New York City and in New York City schools. We're very grateful and we wish all of you the best of health and the best of the holidays ahead of us. And please, if there's anything that we can do for you at Synergy at the Parent Center, please reach out. I know how to get a hold of Jose in case you're having issues at the DOE, and we have the right channels to get through and to support you. So we're happy to provide that. Dr. Ramirez, thank you so much for joining us. We hope to have you back in the future when this is over, hopefully. But thank you so much, everyone. And yes, enjoy the, quick announcement. Tomorrow morning at 10:30, if you're interested and you have a child with autism or interested in the autism program, NEST and Horizon programs, we're doing our series with the Special Education Office at the Department of Education. Tomorrow will be those programs, followed by Office of District 75 the week after on the AIMS program. But yes, and that will be 10:30 in the morning. So if you have questions on that, the directors of each of those programs will be here whenever their date corresponds. So thank you so much and have a great night. Also, you'll have that survey that'll auto-populate. Please fill it out. We look forward to your answers. We really appreciate it. Thank you so much and enjoy your evening.